coming up. Regretting that tattoo?
I'm actually pretty excited about this.
I love it so far, yes.
So you want people to go get tattoos that you don't like so you can come into you so you can remove them.
Welcome back, everybody. Well, here to tell us about the latest in tattoo removal is plastic surgeon Dr. Zell Krajdan.
Welcome to the show, sir.
Thanks, guys.
Good to see you, as always.
Great seeing you.
You know what? Tattoos obviously have been around for a long time. Very, very hot trend right now. But tattoo removal is becoming a hot trend. People are really doing it a lot more.
Oh, yeah. I mean, the demographic has totally changed. A generation ago, tattoos were sailors, war veterans. Now it's pretty much every 35-year-old mom getting one.
Absolutely.
Yeah, absolutely. So what's the best removal for a tattoo?
In general, it's always been lasers. And lasers is a huge umbrella term. Some of the older style lasers worked well, but you needed 10, 15, 20 treatments with only about 50% removal. So they worked reasonably well, but there was nothing really magical about them.
So all they could do is just sort of fade it away, but not remove it.
Exactly. It faded them, and with a lot of treatments and a lot of visits for someone.
And would that be a lot of pain for someone, or was it painless?
It's more pain, but it was more the nuisance. You want to go to someone's office 5 times? No problem. You're going 15 times. It really interferes with your schedule.
Too much. And it just ends up looking messier than it did before, I'm sure.
It could in some cases.
Yeah, okay.
Now,
so
you've got a little video of a procedure. What's the name of the procedure first?
It's called PicoSure. It's a new type of laser that we've brought in at SpaMedica in the past 6-7 months.
Okay.
And here's so talk us through what's happening.
Someone's sitting here. If it's a small area, numbing cream, large area, we freeze it.
Okay.
More or less what I'm doing is zapping down the skin. With PicoSure, it uses a billionth of a second photoacoustic wave to break down, almost explode the pigmentation within the dermal layer of the skin.
Now, that looks like it hurts. Does it hurt?
It's really not too bad. Women who've had laser hair removal will describe it as that sensation.
Yeah.
A lot of my male patients, about 30-40%, described it as an elastic band, a snapping sensation.
Snapping feel. It almost sounds like it looks like it would sound
yes, painful, no.
Okay.
And how many treatments are we looking at to remove?
That's the hugest advantage. You're looking at between 4 and 6 treatments, which compared to the older treatments of 12 and 16, and getting about 70 to 90% removal.
Which is amazing.
Huge difference.
And sometimes you have those dark and intense tattoos that can be very, very effective for you.
So with this technique with PicoSure, it works much better for blacks and for greens, and for those funky colors like whites and golds.
Yeah. So let's talk about skin colors. Is it for all skin types?
It can be used for all skin types, but as a caveat, as a physician, I tell people, you know, your type 1 and 2 skin is very white, pasty skin like mine, pretty safe. You get into darker skin tones, Mediterranean skin tones, you do have to be a little bit more careful about who treats you, how they treat you, and the depth of the wavelength.
Now, is it new? Is this like fresh off the market?
PicoSure is new in the past 6 months, yes.
Okay,
and in 6 months, have you seen a lot of people come in and start trying this particular style?
In my practice, my patients have been people who've gone elsewhere, they've tried 5-6 treatments, they've wasted a good amount of time, a good amount of money, and it's barely faded.
Wow, and you've got some before and after photos.
We have a few to look at.
Which are pretty awesome.
Okay, so this is...
so what's happening here?
This would be a good example. Here's someone's tattoo, old sailor tattoo, that was my analogy.
So faded, it just, you don't even know what it is.
It's been treated 5-6 times. As you guys mentioned, it's now almost worse. It's kind of blended in.
Right.
Here's it right after the treatment. How it gets this white frosted look.
What's happening there? Why is it getting that white frosted
look? The best way to describe it is here's the pigmentation, it explodes. The skin flakes off with a bit of a frost, almost like a partial thickness burn, like a little blistering burn.
Right.
And that is after one treatment. You already have some good fading after that one treatment.
Yeah.
The furthest picture on the right here is after 6 treatments.
And this is considered completely gone or 90%?
You know, the photograph, it does look 100% gone. In person, it's 80 to 90%. But it's faded enough that they can wear their sleeves up. It's not noticeable. If they want, they could re-tattoo something nicer on top of it.
So they can actually a tattoo on top of the removal.
Oh, definitely.
Again, like something if it was hideous or a girlfriend's name that she doesn't like anyway and he's got a new girlfriend.
Sure, I mean, I have one...
Barb is now Sally and he needs to change it to Sally.
Exactly, whatever he'd like. Or Sal, just shorten it.
Oh, you know? Yeah, it could be Sal.
I have one guy on the go now. He has multiple tattoos on his chest, and him and his tattoo artist have come with me with a new plan. I'm fading away some of it, kind of around, and they're going to tattoo around it to make it look a little bit nicer. So you can do things like that to play around.
And this one here, it's literally gone.
This is great. I mean, but this is your perfect patient where it's white skin, one pigment, one color. They came in 3 months after the treatment. They had true tattoo regret, and this is your ideal result. This is your best case scenario.
So why is light skin actually better?
You want a differentiation between your native skin color versus dark tattoo. So white skin, dark tattoo, great.
And this one here, it says a pretty colorful tattoo.
Exactly.
So you're saying colors are pretty good as well.
They can be challenging. There's so many different levels of the skin, and the wavelengths can't attack each skin color exactly and each tattoo pigment exactly. So for the reds, I'm still using the older machines for my reds. I find this PicoSure is great, except for reds. I'll treat someone, all gone, 5 treatments, everyone's happy, but you see these red dots, I bring in the old laser and try and get rid of the reds with that.
And what are the costs for these?
It depends on size. Just like with designing, it's all by square footage. How big is your bathroom? How big is your tattoo? Small area, $300. Large area can go up to $500, $800, depending on how much space we need to do.
Okay, and there's any risks involved, or is it pretty well?
Minor pain, minor bleeding. The next day you can shower, wash your skin, put makeup on it, go right back to work.
Wow.
Okay, so you've done a lot. So you've been doing a lot of these, and you're actually pretty excited about this,
I love it so far, yes.
So you want people to go get tattoos that you don't like, so you can come into you, so you can remove them.
Except on your face.
Enjoy it.
Just on your back.
Don't do it on your face.
Not on your face.
Just do it on your butt.
Exactly.
That's right. Well, great to see you. Thanks so much for being here.
That is fantastic. So there's some great options if you have a tattoo you don't like.
This is amazing, though. This is going to revolutionize your confidence to go out and do it.
Yeah.
Because you're going to know down the road you can get rid of it. So that's awesome. Thank you so much.
Awesome.